So classic signs and symptoms of heart failure. Well, looking back, remember cardiac output needs to increase, so the number one thing would be tachycardia. The heart's trying to compensate blood flow and oxygenation, so tachycardia. Fatigue after activities. So someone becomes very fatigued, and dyspnea. Dyspnea just from doing something. Um, Somebody with really extreme heart failure, just walking across the room is going to make them very short of breath. Sometimes patients do not know they have heart failure. Their heart um, may be increasing, but they don't notice that as much as the cough. The cough may be the first sign that patients know that something's going on because they're doing any activity and that blood is pooling in the lungs, and that's causing a cough. Another thing is orthopnea. They have a hard time laying down and they have to sit up to breathe. Or paroxysmal nocturnal dyspnea. They're laying down and all of a sudden they panic and sit up really fast because they can't catch their breath. Fluid retention. If a patient's gaining 3 pounds in 2 days, that is not a good thing. Right there is kind of your trademark of how much fluid they are retaining. Nocturia, how much a patient gets up in the middle of the night to pee. Um, Obviously, if you drink lots of fluid, anybody, before they go to bed, they might have to get up in the middle of the night. But a heart failure patient, depending how much fluid they have on board, they're going to get up probably more than just one time. If they drink lots of fluid or eat lots of salt, they may be getting up more than average. Skin changes. Skin changes around the body, especially periphery, because you're not getting enough oxygen around all the different organs and peripheral extremities. Behavioral changes. If you've got low oxygen levels all around the body, you can have low oxygen levels for a long period of time in the brain. So CNS changes, personality changes. Now, a patient who already has coronary artery disease would have chest pain at some point on activity or just as it gets worse and worse because they've already got blocked coronaries. So chest pain, angina could be part of it as well because they have coronary artery disease. If these are elderly patients that have heart failure, then your coronary artery disease will increase as well as they age. So other complications. Pleural effusions, blood or fluid collecting in the lungs, arrhythmias. If your heart is stretching and getting bigger and you're having problems with heart failure, that's going to cause arrhythmias. Because of a large ventricle over a long period of time, you would have blood that would pool in the left ventricle and that could form a thrombus. So that clot could go someplace in the brain or in the body. Hepatomegaly. Hepatomegaly in extreme heart failure patients can develop increased size of the liver and then ascites. Now these right here, this one especially, is going to be very extreme class 4 patients over a long period of time. A lot of these things, especially this one, and the heart enlarging and becoming larger, doesn't happen overnight. These are very slow processes. So, treatment for these patients. Well, depending the severity of a heart failure, the patient may have to be on a sodium restricted diet. So, a mild CHF patient, heart failure patient, 2 grams of sodium a day. So we're talking class 2, class 3 patient, probably class 2 even. So these patients need to go to a sodium-free or salt-free. Notice if you were telling a patient to watch and read labels, and then if they've never done that, here are the things they're going to see on their labels. It's going to say sodium-free or salt-free, very low sodium, reduced or less sodium, unsalted or no salt added. So notice salted, unsalted, or no salt added doesn't mean there's not salt in it. They just haven't added any. So this would become very confusing for a patient who doesn't read labels, never has, doesn't understand this. It does get very confusing. So rather than read this part, the patient would have to actually look and see how many grams of sodium. So a severe CHF patient, they might be on a 500 to 1,000 milligram sodium diet a day. These are things that they're going to have to eliminate, and they probably should be eliminated on the other one. Milk, cheese, bread, cereals, canned soup, canned vegetables, all these things are very high in sodium. Lowest in sodium are going to be rice, pasta, fresh frozen vegetables, fresh frozen canned fruit. These things are all low in sodium. But sometimes somebody may not think, well, vegetables are very boring. I want to eat other things. I want the cheese. I want this bread. I want the cereals. So diet therapy. Avoid using salt. Read the labels to determine sodium content. These patients, when they get extreme enough, they need to weigh themselves. If they're in cardiac rehab because of heart failure, they need to keep a log of how much they weigh every day. So if they're gaining that weight, 3 pounds in 2 days, they need to know about it. So you're going to teach these patients to weigh themselves in the morning, same clothes, same time, so they can keep a log and know what's going on. Report weight gain of more than 3 pounds in 2 days. They should eat small, frequent meals. Why eat small, frequent meals? So these patients are going to be on different kinds of medication. Here are a bunch of them. A lot of these medications are for heart failure patients. So diuretics, that's going to manage the overload of the fluid. Notice diuretics. If you need to have the patient have so much fluid off just to manage, dizziness may be an issue, and that may be something they just have to live with. Do you want the horrible heart failure symptoms, or can you manage and still be just so dry from the diuretics you are just a little dizzy? Beta blockers. Beta blockers will slow the disease progression by decreasing chronic sympathetic stimulation that worsens CHF. That increase by the epinephrine, norepinephrine on the heart will, if you can stop that, that'll decrease the slow progression because the heart won't have to beat faster all the time. It slows everything down. ACE inhibitors improve the function of the heart left ventricle. It helps remodel the heart muscle, meaning helps build collaterals and helps you don't have that constriction. So ACE inhibitors help the left ventricle. Digoxin, digitalic glycoside, slows down the heart but also strengthens the heart rate and the contractility. This is all about strengthening the contractility of the heart. Nitrates, if a patient has coronary artery disease, this might help them. Also, it'll decrease your preload, afterload to the vasodilation, so that improves oxygenation. They can take nitrates, PO, for example, isorbide. Morphine, a patient would not be taking morphine at home, but if they're in the hospital for an exacerbation, morphine reduces anxiety and also reduces the preload as well. So another common thing with heart failure patients over a long period of time with any chronic illness is they have depression. They can't do what they used to be able to do. So lifestyle changes. What's going to be changing? Things will not be the same. They have to go through the stages of mourning. It's like death. They can't do things like they used to. They used to go fishing all the time. They can't go fishing. Maybe they used to like to walk. They can't walk anymore. It could be anything. Because of heart failure, they are now not going to be able to do these things. Other things. These patients shouldn't be increasing the activity. They're not going to do that because it causes fatigue. These patients should avoid extreme heats and cold. These patients need to keep their appointments to make sure everything is copacetic and they're being monitored. Patient has to know the signs and symptoms. Education is, why can't I have a bag of Doritos with my beer when I watch the game? Uh, Excessive weight gain because of the extra fluid. Um, they're going to have problems, difficulty breathing, lying flat. Um, from class 2 to class 4, all these things will increase.